Oh, because I put them. I created a YouTube channel, so now.
Oh, you didn't. I didn't bargain for that.
Yeah, it's all right. It'll be good.
You just tell me to go.
Yeah. So, all right. Now I got you as the center of my screen, so for the recording.
Oh, geez, Louise.
Yeah.
Fun stuff.
Yep. So, I guess it's 12 o'clock now. Almost said 11 again, but
I don't. Thanks very much.
But thank you for joining us, and let me let somebody else in. Okay. All right. I'll just keep letting them in as we go, I guess.
Sure.
Whoops. I've got too many tabs open. I'm getting used to this. Oh, here we go. All right, there we go. All right. Nope, there's one more. You're drawing a crowd.
Uh-oh. That's trouble.
Yeah. All right. Well, I guess we'll go ahead and get started. This is Miss Heather Yates-Davis. Thank you for joining us.
One of the other, oops, I'm sorry, did I screw that up? Frankie is one of the other PAs in our office. Hello. And so she's gonna enlighten you because she's a little younger than I am. And so she can tell you some of the different things that she did to get into PA school compared to what I did. Okay. Yeah, we'll just let y'all talk. And students, if y'all feel free to unmute and questions. Yeah. I like to be questions. Yep. I like to talk. So if you don't ask questions, then I'm gonna just I'm gonna ostracize the whole time, and that's not what it's supposed to be. Yeah, this is definitely for them to ask questions too. And then we have Miss Hargraves on, and Mr. Butts is here too. So if y'all have questions, please feel free to ask too.
Okay. So. Good afternoon. How's everybody doing?
Good. How are you?
All good.
Good. How about you?
Okay, we got somebody in the chat.
Something about it, so you'll have to help me with that because I'm on my phone and I can't quite see all that. So okay. Nathan, with that, or Mr. Tom.
Okay, so Kevin, she is going to talk to us all about her education in just a moment. But yes, feel free to put any more questions in there, and I'll try to keep up. Okay, so I am Heather Yates-Davis. I have practiced medicine in Davidson County and Forsyth for 20 years. Frankie, who is also with me, has been a PA for 5 years. We both went to Wake. I'm old, so my experience is slightly different than Frankie's, but it's still, for the most part, pretty much the same. So I'm going to tell you a little story about how I decided I wanted to be a PA. I actually kind of decided in high school. My dad was a lieutenant colonel in the National Guard, and I got to go with him to do some vaccines and some other stuff in Western North Carolina on the Cherokee Indian Reservation, and got to really see what a physician assistant was in action. At that point, I was either headed towards medical school or something in the medical field, possibly even nursing. Wasn't real sure. But when I got to the Indian Reservation, we were able to really see what a physician assistant did with hands-on activity. They were seeing the patient. And again, I've been a PA for 20 years. So there weren't quite as many whenever I started as to when Frankie started. But really being the hands and feet of medicine and having an experience with patients on a daily basis. That physician assistant was in the military, but man, those guys knew some of those folks and could carry on a conversation. They were giving vaccines. They were just checking up on some of the kids. They would play ball with them. And it was just such an interactive place to be. And that's why I decided I was going to figure out what a physician assistant was at that point.
I was a sophomore in high school, knew that I wanted to do something in medicine. So sort of started looking at schools where there were physician's assistant programs. And at that point, there was only 2 in the state of North Carolina, 3, excuse me, because ECU had just started. So Wake and Duke, and then ECU was starting a physician assistant program. So I sort of tailored my education when I started looking at colleges for a science and chemistry degree. I also started immediately at that point, knowing whether you're going into medical school or to be a physician assistant, that experience is important. It's very important, especially to being a master's in physician's assistant studies now. You have to have 1,000 hours, if not more in some programs, of clinical activity. And what does clinical activity mean? So for me, it was being a nurse's aide for hospice patients. That's what I did when I was in high school. So some of you guys are hopefully doing some CNA courses and some things like that to get your foot in the door ready for whether it's nursing or what have you. You think that's the career path that you want.
We do have a with the community college, we have an agreement, and we actually have 4 students. I don't think any of them are in this chat right now, but we have 4 out there right now getting their certification
as a CNA. So if you think you want to do something in medicine specifically as a physician assistant or as a physician, go start now, whether it's at the ER, just being an aide, whether it's in a long-term care facility, whether it's personal care facilities, go start being around patients now. And if you know somebody in the medical field, go try to find some experience and see what it is. It's a little harder now than when I was there. Shadowing, getting some experience with a physician assistant so that you can see what their day-to-day activity is really important. So I went to Wake, or I went to undergrad at Campbell, got a degree in biology, and then went off to Wake Forest, and they prepared me well for the most part for what this crazy world of medicine is. But what I do on a daily basis is see patients all day long. I see everything from a blood pressure problem to diabetes to sometimes freezing off warts. I mean, we do procedures, we do a ton of just regular day-to-day medication management, and really enjoy it. I'm gonna give Frankie just a few minutes and let her tell you her journey to Wake. And because she's a little bit more new, she can give you a little bit more insight on what Wake's most recent or what the PA program and profession most recently wants from students.
That'd be great.
Hello, guys. I'm Frankie. I started to say I'm one of the PAs here with Heather. And so I am a little bit newer. So me and Heather actually went to the same high school in Randolph County. And then I went to NC State for undergrad, and I also biology. Go Wolfpack. And then I went to Wake Forest. And so I kind of knew in high school that I wanted to be in medicine. So I actually did the CNA program while I was in high school. So, my senior year, I went and rotated at different offices and got my CNA certification so that once I got into college, I never worked like during college, so to say, but like all of my summer breaks and like my Christmas break, I worked as an in-home CNA for one of the local hospitals. So I basically went into people's houses and helped took care of them. Very basic stuff, things like bathing and feeding, and helping clean up and stuff like that. So, but that gives you really good clinical hours. And so I actually graduated from NC State in 2014. In May, and then 2 weeks later I started PA school at Wake Forest. So it was like really quick. A lot of people that go to PA school don't know that they want to go to PA school like me and Heather did. So a lot of people come from the military. A lot of people, it's a second career. We had people that had been in medicine before, like an x-ray technician, or they maybe worked in a pharmacy or something like that. But there's other people that did something completely different before. So we even had one person in our class that was a teacher, and they had been a teacher for years, and then decided they want to go back. So it's pretty cool that the PA profession is very flexible. And so anyways, I then graduated from Wake Forest in 2016. But the thing that's different about PAs than being like a doctor or a physician is that we can change what we want to do. So like if you become, let's say, a doctor that works in the emergency room, you have to work in pretty much the emergency room the rest of your career. If tomorrow, so we work in primary care, like family medicine, but if tomorrow I decided I don't want to do
Hello.
I could work in any specialty. So I could go work in urology, which is like urine and kidney problems. I could go work in orthopedics, which is like bone problems. So that's really cool that we're able to be flexible. Here in our office, we pretty much do the same thing as doctors. We see the same amount of patients, we see the same stuff, but then other specialties are a little bit different. So if you're in a specialty that may be like orthopedics, sometimes you might be in the operating room helping, with fractures or helping with hip replacements and things like that. So every specialty looks very different. We see patients just like everybody else. But I agree with Heather. I encourage you guys to start looking now into what you want to do. It may not be medicine, and that's okay, but go shadow somebody. I think so many people get into college and they have no idea what they want to do, which is okay too. But if you go shadow somebody for a day, it just helps you to be like, oh, I don't want to do that. Or, oh, yeah, I want to do that. And just one day or even a couple hours helps you to be like, hey, I think I could do this for the rest of my life.
Caleb asked, which specialty would you recommend?
So that is a loaded question. I like family medicine because I see a variety of things. So just like Heather said, we see a little bit of everything. We see mental health problems. We see orthopedic problems like, hey, I have knee pain or ankle pain. So I see a little bit of everything. So it doesn't get boring. You never know what's going to happen. Versus a specialty, you're really honed in on only certain things. So like if you were to go let's say you had headaches and you needed to go see a headache specialist, that would be a neurologist. They don't take care of other stuff. They only do one thing. So I like primary care because I get to see a variety of things, but I also like that my schedule is a little bit different. So in primary care, I work 4.5 days a week. I don't work weekends. And so my schedule is for the most part 8 to 5. We still do work at home. But for example, if you're in the emergency department, you work all kinds of hours. So you may work, whenever I rotated in the emergency department, I would go in at like 2:00 and get off at like 11 p.m. So like you have to decide too what's important for yourself and your quality of life and your family too also makes a difference about what specialty you may choose.
And I agree with Frankie completely on that one. But I also would say sometimes I think you figure out which specialty you like while you're in school because certain things fit your fit your personality. I love old people. So for the first 5 years of my career, I took care of old people. I did geriatrics at Baptist. I would take, it's an internal medicine clinic. I just saw blood pressure patients and all of those kinds of things. And so that was what I particularly liked. And I still see a majority of older patients here, whereas Frankie sees a tremendous amount of the younger population, and also does a lot more maybe wellness physicals and child checks. I tend to see a ton more diabetes. So even in a small practice as ours, Gina and Frankie see a ton more of the younger females, a lot more kids, whereas I'm going to do a lot more older patients, falls, frail, elderly, because that's what I particularly like. Now, we also do age with our patients. So I've been here longer than Frankie. So my patients have also aged through the years. And so that also has been helpful as far as the geriatric part, which is my favorite. But I think you figure out during PA school what your calling is, or even in medicine, you're going to do rotations and those kinds of things. And you're going to make some decisions. Oh, I love skin. I love dermatology. I like taking things off all day long. I like doing procedures. I really want to be in the OR with the doctor doing hip replacements. Now that's pretty cool, but I wouldn't want to do that every day of my life because you got to get up at 4:00 in the morning to be at the OR at 6. So that's not me. I don't like mornings. So I think you'll figure out when you're in doing some rotations or shadowing, those things that are fit your personality.
One thing.
Great question.
Yes, I completely agree on that. One thing I will say that a lot of people don't quite understand how PA school works. So Wake Forest program at least is 24 months straight through. So like it's pretty much 2 years, but you don't really get summer break and spring breaks and those kind of things. You kind of go straight on through. But the first whole year is kind of being in a classroom. You do a lot of like problem-based learning is what they call it, where you basically, hey, this person has a sore throat. You got to figure out what they have. And you kind of go through the different things. And that's kind of whole like classroom work. Your whole second year though is all rotations. So I had 11 clinical rotations, and every single month I was in a different specialty. So I rotated in dermatology. I rotated in orthopedics, neurology, emergency department, OBGYN, all those different specialties. So that's why we are trained in lots of different stuff, not just one thing.
That's really all very interesting. To the geriatric part, is that why you see me as a patient, Heather? Y'all mentioned job shadowing several times. Is that something that is an option for high school students?
So that becomes a bit tricky because of HIPAA laws and such as that. You have to be certified through like a CNA program or something in order to even make it into some of our offices, except Forsyth and Wake Forest both do a really good job. About February, I'll send you some information, Nathan, when I get it. About February, they take a bunch of high school kids and put them in all different kinds of practices so that they can do so that they can experience they may go to the hospital and do radiology. They'll try to fit them where the high schoolers want to kind of go or what they think they might want to do. I've sent several patients from Oak Grove and North to some of those programs at Forsyth. I'm not sure how difficult it would be for your kids to get all the way to Winston, but we also have Thomasville that's not very far, and they send kids over there to the pharmacy, to the outpatient clinics. Now you might be doing some jobs like walking a patient back to the room and those kinds of things, but you're still getting patient interaction and you're watching what happens in an office and getting some experience. And we're generally pretty good about that. I just saw that. I'm sorry, I was reading as I was talking and I don't do very well at that. I did see that about veterinarian shadowing. We have had one of our staff members daughter who did do some veterinarian shadowing, and that was really pretty cool.
Some of the local vet clinics do
really do. That one's really not hard because you don't have to keep privacy information and that kind of stuff quite. Yeah. And man, it's pretty cool to be able to go in and watch them do surgeries. I don't know that I could I'm pretty tenderhearted, and putting a dog to sleep or something like that would probably tear me apart. But you get to experience all those things that dogs need.
I have had some students do it at Jordan or at.
Yep.
That's where one of our employees' daughter, she worked for several years and also shadowed. So.
Yep. And she's now preparing to go to vet school.
Yep.
So, I mean, she figured out that that's what she loved to do because she simply did shadowing. Even as much as if you want to go do plumbing, go shadow somebody who's in the business, in that specific business that you want to do, because you're going to figure out quickly, I don't want to climb under a house where spiders are.
Right.
That's what you don't like.
Yeah, definitely send me that information.
It won't come till I think February. COVID screwed everything up last year.
Usually it's in the summer months mainly.
But you got to apply in February, and then they pick you from different candidates.
I'm gonna run because I gotta go do some things for patients, but good luck to all of you guys. If you have questions, Nathan has our information and he can totally get in touch with us. Okay.
Thank you.
Frankie, I'm here for a few more minutes. I know somebody else had a question.
I think Kaylee has a question.
Can you guys hear me?
Yes,
Yeah.
ma'am.
Okay, so I was wondering, since you guys would practice with different other things, so does that help kind of open your options for if you want to start like another job or something?
Absolutely. So I'll tell you a little bit about my experience. I worked in geriatrics for 5 years. So you're absolutely correct. I worked in geriatrics for 5 years, and Dr. Henson, I knew of him, and he was losing a nurse practitioner, and he called and said, do you want to move to family practice? And that's why I ended up here. We have had some other physician's assistants here, and she literally started in family medicine with us, got married, and then moved to Texas because of her husband's job. And she ended up in pediatric surgery. So we can pretty much transfer within those, into different specialties. We learn a lot of our stuff on the job. So because we are physician's assistants and not, based solely in family medicine or emergency medicine or cardiothoracic surgery, although we all know stuff about, or cardiothoracic surgeons certainly know a lot about primary care or diabetes, we are also trained a lot on the job. So if I left today and went to a job at urology, I would learn some of those things of the trade. Great question.
I actually had one more.
Sure.
So, a physician assistant and an LVN, is that kind of around the same thing?
So that's not actually. A physician assistant is actually board certified with the medical board. So I am board certified with the North Carolina Medical Board. An LPN really can only do what a physician or a physician assistant or a nurse practitioner says. So I am one step under a physician, as is a nurse practitioner. We can own our own practice. I can prescribe medicines on my own. I can see patients on my own, and I can do procedures on my own. LPN cannot do anything without a physician's order. Same for an RN. So I'm going to go up the hierarchy of medicine. So as you finish up high school and you guys are getting CNAs and such as that, that's sort of the lowest, but most important on the totem pole. And then it's an LPN and an RN. They both are in the hospital. We have an RN here. She is our office manager, but we also have an RN who does some triage stuff. She can't function without us as medical providers. I am essentially a medical provider, essentially the same thing as a doctor. A doctor goes for 4 years and specializes in a specific practice, whether it's plastic surgery, whether it's pediatrics, whether it's family medicine. A physician assistant goes for 2 years, and we can do a broad base of medicine, but it's a lot of on-the-job training. A difference between a physician assistant, nurse practitioner, and a physician also is that once physicians finish medical school, they have to go off to a residency. So they spend somewhere between 3 and 7 years honing a practice. So in other words, getting more expertise in their field.
Do you think starting as an LVN and working your way up to a physician assistant would be a good idea to kind of start off and then just work your way up?
So that's a great question. Yes, I think that's perfect. The big issue with being an LPN versus a physician assistant is that you have to get a bachelor's of science. So an LPN is a associate's degree, but if you finish your CNA at the college or community college level and then finish your LPN and get into that's Alex. That's one of our other PAs.
What's this?
On a high school call.
Oh.
Of prospective students. That's Alex. He's the one that likes to cut everybody around here. He likes to dig into abscesses and all kinds of crazy stuff. So he does all kinds of surgical procedures. But at any rate, at LPN, you get your associate's degree, and then you go to Winston-Salem State and you would get a bachelor's degree, and then from there apply to PA school.
That's great information. Thank you. I've never understood all that hierarchy and stuff. Does anybody else have any more questions?
Absolutely, Mackenzie. If you have questions, I will be happy to answer. I'll talk to you about a rheumatologist. I'll be happy to talk to email. Nathan has my email. I'll be happy to email you if you've got specific questions when y'all finish up. Rheumatologist is actually the study of inflammatory diseases, whether it's lupus or some other autoimmune process. So sometimes our body decides to fight itself instead. I'm sorry, Alex is yelling. Hang on just a minute. Let me close the door. So instead of it being a wear and tear process of our body, so sometimes when you're fluffy and overweight, your knees start to hurt. That's a wear and tear arthritis. That's more of an orthopedist that fixes those problems. Sometimes our body attacks ourselves, and that's what the rheumatologist fixes. Things like lupus, things like rheumatoid arthritis. There's a ton of other disease processes that they look at, sojourns, all kinds of crazy stuff. They're very specialized. Just like a endocrinologist is very specialized. They work on the endocrine system. I don't know if any of you guys are taking anatomy, but that thyroid that's in your throat, or the pancreas, those things are what the endocrinologists tend to look after.
Good question. Anybody
May I
else?
add something after? I can just go volunteer at a local animal shelter and get my hours there.
So I think as far as for veterinarian stuff, yes, I think you can. Animal shelters doing some of the tasks and being around dogs and being around animals, I think that's really helpful. Then they would be able to get you in touch with some of the veterinarians that are in town. We have some great veterinarian facilities here. They're pretty awesome.
We've had lots of kids do that in the past, and you just have to call the shelter and they're happy to take any help.
Yep.
How much harder has COVID made your job?
I don't know that that's a fair question. I'll answer you, and Zion, I'll give you an answer in just a minute about my salary. COVID, unfortunately, is not a nice word in my world. We in primary care are fortunate. I'm not taking care of the sickest of the sick in the hospital. I have great friends that are in the hospital and they're risking their lives certainly every single day. Most of the patients that we have seen here, we're seeing all outpatient outside, doing swabs, taking care of them, listening to their lungs, those kinds of things, and helping manage their symptoms as an outpatient. But it has certainly changed the nature of medicine, at least temporarily. We're all concerned. We're all trying to make sure that we're staying safe. We gown and glove and are protected with PPE when we go see a patient that could have COVID. So it has made it different, harder yet different. Zion, you asked about salary, so I'm going to give you this is a tough one, to be honest with you. I started out 20 years ago making about $65,000 a year. And that has significantly increased. I'm going to be real honest with you. I am very fortunate. I work for Novant and they are very fair with their salaries. So at our practice, I make a portion of what I see. So if I'm lazy and I really don't want to see very many patients, which some days I can be that way, I suffer the consequence and don't make as much money. So that's an unfortunate way to sometimes practice medicine. But I think one of the things that I really strive to do is to make sure that I treat every patient the same. I do make over six figures. That's a tough one to say as I'm sitting at here, but most physicians make in the average of $200,000 for family practice. Most physician assistants make about $100,000 as a family practice PA. I do make a little more. Is that specific enough? So the average physician assistant salary is about $100,000, depending on which specialty. I will tell you, orthopedic PAs make $200,000. I do not. Kevin, you asked another question. Do you do internships, I think, while studying? Is that your question? I'm sorry, I missed his question, Nathan.
Yeah, I think that's it. That was it. Yeah.
So there's a couple of different ways to answer that. I did not do any internships at all while studying. I did everything before I got into PA school. Bye Kaylee. I did as a physician assistant or as a student, I did everything I could beforehand. And then once I got into the PA program at Wake, I did not do any kind of work at all. I didn't work as a CNA. I didn't work anything at all because the program is quite demanding. I had finished my undergrad and then I went to PA school to get a master's degree. And we went to school class from 8 to 5 every day the first year. Then the second year we were in doctor's offices, just like when you go see your regular doctor. As a PA now, you can specialize. We have some, sorry guys, sorry. We have some guys who really want to do certain specialties. So there's some cardiothoracic specialties where folks are going in and putting in, for lack of this is way too complex probably, but cadaver, heart valves and things into patients, and they go in and do internships, but that's after PA school because they really want to do some sort of surgical program. That's way beyond what I want to do.
May I ask?
Yes.
So like if you went to school for like anything else such as technology or something like that, could you end up working in the medical field in any way?
So that's a really great question. So we have a bunch of folks in our office. I'm in outpatient medicine. So I take care of normal everyday patients. If you need your sports physicals, you're coming to me. So my nurse, her name is Kendra. She is actually not a nurse. She got a CMA license at DCCC, I think is where she got hers. But to begin with, she actually did computer technology. She got an associate's degree in computer technology. So she ended up getting a different type of degree. She's the one that takes my patients' blood pressures every day. She gives Nathan a shot. If he needs a shot, she has to chase him around the office. She needs to do something, she's the one that's actually doing a ton more stuff. To be honest with you, she's probably smarter than I am. But she's doing a ton of stuff in the office for us. She's giving flu shots all day today. So you can go into and get, say a computer technology degree. You can work on our computer systems. We have great people who keep me sane some days, who are the computer programmers that are behind our big system that keeps your charts safe. So you can go to DCCC and get a degree in computer technology and then come work for Forsyth and work in their computer programs to help me whenever I can't get on my computer because I'm not as computer literate as you guys are. So there's tons of things in medicine that are not as a physician or a physician assistant or an LPN or an RN that have great value. We have 6 girls up front that have all different subsets of skills. They're the ones that are, getting my patients scheduled for their colonoscopy or for their gallbladder surgery. So there's all kinds of people that make a medical office run or a hospital run.
Okay, thank you.
Sure. Medicine's a great place to be. It's always going to give you a little stability, even if it's in a regular doctor's office as a CNA or an office assistant. Come on in, you're good. Okay. I'm on a phone call, but yeah. So there's great places to be in medicine for sure.
That was a good question too.
Same as veterinarian office. I think you could probably apply the same for a vet office. They're going to have front staff folks who are doing completely different things. That aren't necessarily with the animals or what have you.
Does anybody have any last questions? Don't want to keep her all day from her patients.
I'm done.
I don't have any.
Oh,
I'm sorry. Somebody asked a question. I apologize.
I said I don't have any.
okay, great. All right. Last call, everybody.
When we were talking about salary before,
Yes, sir.
can your salary differ based off of whatever field you're in?
Yes, it does. Absolutely. So an orthopedic PA makes a whole lot more than what I do, but I still make a great living as a primary care PA. And I have a little bit of an advantage to some degree. At least I say I do. I don't have to get up at 6 in the morning and I don't have to work really long hours. And I only work 4.5 days a week. So I make over $100,000 every year, and only work 4.5 days a week. Whereas the orthopedic PA may work 60 hours and he may make $200,000, but it's about quality of life and what you like to do. If you like to go to the OR, then you're not going to feel like that's a chore. I would feel like that's a chore. Somebody asked, when did I start working with seniors? I started working with seniors when I was in high school. I worked in hospice. That was my first job as a CNA. So I finished my course with CNA work and went to work for hospice right close after. It's interesting. My first patient was an HIV patient who I would go to his home and take care of. So that was my first patient.
Have you ever ended up having to like teach anybody else like that wasn't in your field, anything about that was in your field, like anybody you had to teach or learn from?
So I teach students all the time. I take a PA student a couple times a year. So that is in my field. I've had nurse students, had PA students. I've helped teach medical students. Specifically, our office really does help with the CMA program at the college, and that makes a huge difference. So we have students in all the time, and I always teach. I love to teach.
So when you like started working with seniors, like do you have to be like a certain age to be able to get into certain programs?
So you have to finish. Probably. Well, I don't know that answer, to be honest with you. Probably you have to be 18 to be in certain jobs. But once you finish your CNA, you can work in, say, for instance, what's the one close by? The Bryan Center. You can work down there if you're 17.
I think to go into the CNA program, it's called Nurse Aid now at DCCC. You have to be 17 and a half on the first day of class.
Gotcha.
Yeah. So that was a good question too.
That was a great question. But you know what else you can do? I really remember doing this as a CNA or as a student in high school, volunteering your time, for instance, like at hospice. They have programs, and the hospital has programs minus COVID. That makes a big difference at the moment, to be honest, guys. Once COVID is over, hospice has great programs where you can go sit with folks at the hospice house, or and just sit and be with folks, and just volunteer. You can do that pretty easily. Minus COVID, once COVID is over.
Can you use those hours that you get volunteering, like if you decide to go to PA school?
Yes, some of those hours can transfer. Some of those hours will transfer.
Very good. Anybody else?
Mackenzie's asking something about 16. I can't read all of it. I'm sorry, Nathan.
Oh, okay. She says
almost 16, and do you have any recommendations for her to go to?
Again, once COVID is over, I know that long-term care facilities have a ton of patients who don't have anybody who love on them and care for them. So call the resident director or the activities director and see if they can get you hooked up with a senior to go sit with. You may have to pass a background check and those kinds of things, but I think that that's still, that's a reasonable question, Mackenzie.
all right, great. All right, we've been taking almost all of your lunch.
No worries.
Okay. Last call, anybody? Okay.
Well, thanks, guys. I'm grateful that you guys let me spend the day with you.
Yeah, thank you for doing this, Heather.
By all means, send me a message if there's questions that get lost.
Okay, we will.
Thanks, guys.
Have a good weekend.
You too. Bye, guys.